Kidney stones. Types of kidney stones and risk factors of kidney stones. Kidney stones, also known as renal stones. So, before knowing about kidney stones, I just want to tell you a little bit about functions of kidney. Kidney plays an important role in excretion of many metabolic breakdown products, including ammonia, urea and creatinine from protein, and uric acid from nucleic acids, drugs and toxins. Kidney also plays an important role in regulation of fluid and electrolyte balance. Kidney regulates acid-base homeostasis, calcium and phosphate homeostasis, vitamin D metabolism and production of red blood cells. It has very important role in regulation of blood pressure also. Renal stone or kidney stone disease is common, which can affect all age group and in individuals living anywhere in the world. Kidney stone consists of aggregates of crystals which may be either calcium or phosphate or proteins. Kidney stones form in urine and can travel from kidney to bladder through the urinary tract. So it may be anywhere from the kidney to the ureter. Size of calculi or stone may vary greatly from a minute sand particle to large round stone, usually in the bladder. Usually crystal deposition occurs in concentrated urine, therefore dehydration is a major risk factor for stone formation. Very small stones usually pass through urine without any problem, but larger stone causes obstruction and causes pain, infection and bleeding. Sites of obstruction. Common sites of obstruction from a stone in the upper urinary tract are located at the junction where the kidney meets the upper ureter, at mid portion of the ureter or lower ureter at its entry into the bladder. Based on the location of stone term used, for example, stone in the kidney called as nephrolithiasis, stone in the urinary tract termed as urolithiasis, stone in the ureter termed as ureterolithiasis. Types of stones. Calcium oxalate 60%, calcium phosphate 15%, magnesium ammonium phosphate or struvite 15%, uric acid 10%, cysteine and others 1%. Most common types of kidney stone is calcium or calcium oxalate around 60% and least common type of kidney stone is cysteine, which is around 1%. Calcium stones. When calcium combines with another mineral like oxalate or phosphate, then calcium oxalate or calcium phosphate insoluble crystals form. These can be easily seen on plain X-ray. Usually, no specific cause is found on why these stones develop. However, they can occur in certain medical conditions such as hyperparathyroidism, certain types of weight reduction surgery, and in several types of kidney disorders. Magnesium ammonium phosphate or struvite stones. Most important cause is infection of urinary tract by urease producing organism, which causes rapid stone growth. Uric acid stones. Uric acid is a product of purine metabolism. Uric acid is 100 times more soluble at a pH more than 6 compared to a pH less than 5.5. Other than dehydration, the most common risk factor for uric acid stone is persistently acidic urine. More commonly due to excessive high protein diet, obesity, or gout. These stones cannot be seen on plain X-ray. Cystine stones. These are rare and due to an inherited defect in amino acid transport within the kidney. An excess of cystine crystals are found in the urine of affected patients which clump together to form stones. Patients who are affected tend to be young and develop recurrent kidney stones throughout life. Long-term treatment involves close surveillance, education, dietary changes, fluids, and sometimes medications to prevent the stones from recurring. Predisposing factors for the kidney stones. Environmental causes. High ambient temperature and decreased fluid intake leads to dehydration, which is a very important risk factor for the kidney stones. Dietary causes. Diet high in protein, high in sodium, and low calcium promotes the renal stone. Medical causes like hypercalcemia due to any cause, hyperparathyroidism, gout, renal tubular acidosis, and urinary tract infection are major risk factors for the kidney stones. Surgical causes. Surgeries like ileal resection or gastrointestinal tract surgery, weight loss surgery can also promote the kidney stones. Hereditary cause. If someone in the family has history of renal stone, then there are more chances to develop renal stone in the individual. Some diseases like familial hypercalciuria, cystinuria, medullary sponge kidney, primary hyperoxaluria are other conditions which can cause the kidney stones. Medicines. People taking certain medications like diuretics, calcium-based antacids, indinavir, that's protease inhibitor used for treatment of HIV, topiramate, anti-seizure are also at increased risk of developing the kidney stones. In my next video, you will see about signs and symptoms, how to diagnose kidney stones, treatment of kidney stones, preventive measures, and natural tips to prevent kidney stones. For more updates on healthy lifestyle and medical problems, visit www.askmeforadvice.com. Thank you for watching. Do not forget to like and subscribe.